So what they're saying, right? Just be clear for our audience, because I actually read that article. I didn't look at that. But what they said was
dropping gems like we preaching. Yo, what's going on? What's going on? It's the jury's out, baby. We back with another one, the Raw Uncut podcast, where we talk about anything and everywhere because
the jury's out.
Yes, right. Yes. And I'm here with two great people, essential workers for sure. Here with Frederick Rowan and Jasmin Frederick. Rowen Frederick. There we go. Sir. I listen. I know. How y'all doing, man? Welcome to the show.
We're great.
Just bring it a little bit closer so we can hear you. Yeah. So you know my name. I'm Ev. Here with Gene, Jack,
what up?
Splat. So let's just jump into it. So you guys are in the medical field, medical profession. Just tell the people what you do briefly. Whoever wants to start first.
I'm a family nurse practitioner. Right now I work in urgent care, so I'm responsible for everybody that comes through my space. Mm-hmm. So I'm in charge of pretty much diagnosing medical stuff for you.
Diagnosing medical things. Yes. Okay.
We need that.
Yeah, right.
We need that.
How long you been doing that for?
2 years now, but I've been a nurse for 8 years.
Okay. Got you.
Yeah, so I've been a nurse for 9 years. Started out in the ER. I worked in 2 ERs, one in Harlem and the other in the Upper West Side. Total of 8 years, and I just moved to the cardiac cath lab. So I'm there now, and I'm trying to learn as much as I can.
Okay. What's that, the cath lab?
The cath lab? So it's a cardiac cath lab. So do you know when someone has like a heart attack? Yeah. So so our doctors would go in and they'll like put in like a stent, or they'll put in like a balloon and they'll open up the artery in the heart.
Mm-hmm. Yeah. Okay.
Yeah.
So it's only specifically for the heart.
No. So we also do like the legs. So if someone has like a blockage in their leg, like you're sitting and it gets numb, it could be like that artery is like getting squeezed. Mm-hmm. So they'll go in and they'll put a balloon in there, they'll make it wide, and they'll put in like a metal stent to keep it open.
Oh, okay.
Yeah. A stent is like a straw that goes in and just keep it wide.
And it had like a balloon at the end of it, and it would inflate.
Yes. Yeah. Yes, it would go in there and make that.
My boy was telling me a terrible story about somebody who had that balloon where you would not want it, and maybe it was because
of dick.
Yes.
Damn.
Yes.
Oh.
Yo, that's hard.
And I can't remember why he said. Maybe was it a kidney stone? Maybe I don't know what it was, but it was some reason like they had to put a Foley up there.
Yeah. A Foley. Got it.
Oh,
yeah. Yes.
The arm Foley is Dicky.
Yeah, but I think they like put him to sleep, but then he woke up and started bugging out.
That's crazy.
And the shit came out.
I would be
inflated.
Oh my gosh.
So there was blood everywhere. All right, you know what? We're getting off topic. Every time I hear Foley now,
when it comes to horrible medical stories, I'm sure they got plenty of things.
They got a bank full of them.
This ain't about me. I'm just talking shit. All right, so what made you get into the medical field to begin with?
Me? Well, mine is it wasn't even me. It was actually my mom. She was like, well, you're going to college. You don't know what you're going to do. So I'm going to apply to nursing school for you. So she did that. I went to college in Mount St. Vincent for like
I hear that name a lot.
Or for like a short stint. And then I got in and I just went.
So because your mom just was like, nah, you're gonna be a doctor?
No, a nurse.
No, but like, is that why she made you apply?
Well, she said you need to make money and you like to help folks, so I want you to be a nurse and you can make money, you can do whatever it is that you want when you're a nurse, but you're gonna do something where you're gonna make money.
Did you have an idea of what you wanted to do before she made that decision?
I had no idea, man.
Yeah.
Clueless.
Yeah.
I don't know.
Because it's interesting, but like, you got into that because my wife is a nurse practitioner, and when she was in school, she would be showing me like the textbooks and all the open bodies and stuff, and I'm like, yo, I like to help people, but I ain't trying to see all that. Like, so like, I'm sure, like, so not only that, but you also had the stomach to like, you know, get through that, right? But what did you have a moment where you were like, oh man, like, you know, my mom made me do, like, you know, it made more than encourage me to do this, but now I'm here, and all of a sudden I'm seeing open bodies, or I'm seeing all this other stuff, and your mind wasn't like hesitant, like you were just like, nope, I can roll with this. What's up?
There
like,
was actually no shock. It was actually fun.
Right.
You get to see
so mom knows what she was doing, right?
I'm from Brooklyn. I see a lot of crazy shit.
Yeah.
So,
I mean, me too, but I'm not trying to see it all the time. Like, I was like, oh, that shit.
Blood everywhere. The shit was great.
Yeah.
What about you, Jasmine?
Well, I became a nurse because I wanted to. We did an internship at Lincoln Hospital in the Bronx, and I follow a nurse there, and I loved how she always helped patients. I can see blood. I'm not scared to be around gunshots in the ER, in the OR, whatever. I'm used to that stuff. So then,
Bronx, right? Bronx.
You did this internship in high school? Like,
High school.
Oh,
Yeah,
okay.
so we were supposed to do an internship, and I just chose to do Lincoln Hospital because it was like right across the street from my high school. So that's how I got the inspiration.
Wow.
So then I went to college, and I didn't exactly go straight into nursing. I just did liberal arts, and then I decided, let's do nursing school, and I did nursing school, and then I became a NP.
Okay.
And the reason why I became an NP was because I didn't want to do all the manual work that what Rowen would be doing.
So what's the difference between what you two do?
So mine is more like the nitty gritty. You take your orders, you see your patients most, and you know you work them up, and you pretty much take care of your patients based on the orders of the NP or your PA or your doctor, and you know you do the bedside stuff. For hers is more so like she would look at the labs, order meds and things like that. You talk to the patients, but it's not as much manual work.
Mental
as a
work.
nurse. It's more
Yeah.
mental.
More
She's
mental.
a lot smarter. She's a lot smarter.
Like, what kind
As
what do you
always.
mean mental work? What kind of mental
Like,
work?
I have to decide, do I need, like, a person comes for chest pain. Is it because of a cold, or is it because of the heart? So I have to do it based on what the patient tells me. Like, I have to order EKG, I have to order blood work versus just give them cold medicine type of thing.
So you're like House.
Yeah.
Except you follow the damn
But you're a lot nicer. So you're.
Yes, I am nicer.
You're not gonna purposely let somebody fucking flatline on the table to see what's wrong.
Like, see, you wasn't listening to me. So then, how was that? You didn't like it? Cool. Now listen.
Episode of House.
I would say I love.
Do that shit all the fucking time.
House lets people die.
Yeah.
It brings them back.
He lets them die, but he knows they're not really gonna die. Because he just be knowing that shit.
He's a super genius.
He's a super genius. Be high as motherfucker too. So, so okay.
I'm good. I love being an MP though.
Yeah.
It is mentally stressful, but the things that I do to change people's lives at the end of the day, because I work in urgent care now, and a lot of people can get to their primary care providers, and I'm there to help out. So I read for medications. I, see whatever problems they have to solve them until they can see their doctor maybe 3 months later. So I can change people's lives in a different way.
So you guys are both in urgent care. Do you like urgent care, or is this just a stop along the way of what you want to do?
I say a stop along the way to what I want to do. This
Okay.
was my first job, and that was the first thing I could get into as an MP, because you want to get your experience in and to get the hours. So the next thing I want to do is either, right now I'm getting into like injections, cosmetic injections, because as an MP, which is different from a nurse, you can actually own practices.
Oh, really? Okay. So you want to open up a cosmetic type of
Beauty shop.
An aesthetic clinic.
okay.
Yeah.
Okay.
So you're like if if my cheeks start to drip, you give me the Botox or
That's
something
right.
like that. Yeah.
It was like
Cosmetic. Yeah,
Cosmetic.
Yeah, but not so much surgery. Like
Not surgery, yeah. That was
just-
more like a doctor,
Right,
like
right.
more like fillers, get your lips, you know.
Yeah. Right. No booty injections, no. That's more cut and sew.
What about you, bro? What do you?
So me, my plan is to go down the family nurse practitioner path. Right now, after being nine years in, it's getting a little bit boring, and I know that I could do a lot more, and I want to make a shit ton of money. I love money. So I'm gonna follow her. I'm gonna go back to school.
Okay.
And finish and try to find a job that makes me some money.
Yeah, but now you said family NP. So is that different than
She's actually
I'm a family.
FMP.
Okay. So are there different NPs, or is like there's a family NP? My wife is a pediatric NP. So like are there other different ones from those two
Many.
as well?
There's
There are many.
critical
There's critical
care.
NP.
You got PACU MPs.
Yeah.
Is that just a job title, or is that
No.
like something you study?
Is it
at-
specialty?
You have to
It is
study.
specialty.
You have to get certifications
Oh,
and all
wow.
that.
Okay.
So it's like another year or two.
Okay.
Yeah, but once you're in, if you work in an area and you learn a lot of that field, you kind of what's the word I'm looking for? You
Kinda hit the ceiling?
Specialize in that field, and you pretty much become that. Like you can be a cardiac, like an interventional cardiology NP.
Okay.
You can
So
be,
that's your specialty, basically.
yeah.
Got you. Okay.
Right. So the MP is like the umbrella license, and then you can branch off.
Branch
You can branch
off
off,
into it.
Right,
yeah.
into so many things.
And is that
Certifying different things, yeah.
is that like what part of the educational process is that decision made? Is that something you have to know when you first get into nurse practitioner school?
Well, yes. So for me, if I wanted to work in a hospital, I would have to go study critical care. I didn't want to work in a hospital. I wanted to do more clinic, so I did family.
Oh, so that's like it's almost like a separate school.
Yeah, separate school.
Yeah.
You could do women's health. You focus only on women. You could do peds,
Wow.
only pediatrics. So yeah,
So-
separate school.
So just to break it down even further, college. What did you major in?
Nursing.
Nursing. Okay, that's easy. And then after you graduate college,
Well, it's not easy, but
All right, it's not easy.
I was hugging my wife in the shower during that.
I was crying.
Nursing is hard. I'm not saying that's easy. I'm saying that's easy to remember. That's what you
Process. Okay.
It's gonna be okay, baby. It's gonna be okay.
I went to
I don't want to fucking do this.
I went to college in St. Vincent, so there's a very clear path that all these nursing students went through.
Right.
So I guess explain that part, which is that you do first 2 years of certain prerequisites, and then you start clinicals, right?
Yeah. So, I mean, you had I had a different route
Yeah,
because I did
very different. for
very
us.
different routes. So.
Okay.
Good. That's good. We can talk about the differences. Yeah. So what
If
was
you
yours?
want the traditional route, it's 4 years in nursing. So your first 2 years, you're doing your prereqs, you're doing your recs for the college, regular courses, and then the second, like the last 2 years, you're doing the clinical portion, and you're going to different sites, different hospitals, and everything. And then after you do your 4 years, you can choose to work, or they have bridge programs where you can do your master's degree. And that's where you're going to pick what MP school you want to go to.
And how long is the master's program?
It depends. Full time is 2 years and part time is 3 years.
Okay. All right.
And after that, you have to get a board certification. So you're not just getting a license, you have to get a board certification.
What's the difference between the two?
So the license is you're able to work. Your certification shows that. How do you explain certification?
It just shows that you're competent enough to practice, not just to graduate school, but you're competent to practice at a certain level.
Okay.
Yeah.
And so that was your path.
That was my path.
Okay.
Yeah.
And then your path was
Very
different.
different. I went to junior college. I went to Long Island College Hospital School of Nursing. I got my associates in nursing. After I did that, I worked for a few years, made some money.
Cash
then love money.
Capitalism, baby. You gotta make money.
And I got my bachelor's online. It's not 100% online because there is the clinical portion of it. Right. So there's like a year where you have to, you got to go to like sites, whether it's an ER, wherever it is that you end up, you pretty much meet, you do these hours, you fill it, you write like stuff about what you did.
Okay, like any internship.
Yeah.
Do your hours, write about what you
During
did.
those clinical hours, you're a nursing assistant, something like that?
No, you're pretty much a student.
You're just a student. Yeah. You're like a nursing assistant. Yeah, because you can't really touch the patient, but you're like kind of propping the pillows and whatever they need. But you're at the same time learning from the teacher what to do.
Yep.
Got you.
Yeah.
All right, so like, I guess I would consider you guys like one of the few maybe that, stick with the field despite COVID. COVID's been crazy on the medical field. A lot of people, tapped out. They just couldn't take it. And understandably, right? Like it was just something traumatic that I could never, go through and never, visualize, people just having to choose between who lives, because you have both people who could potentially, need your help, but you just don't have the manpower to help them. Talk about how that was like and how COVID, your experiences during the height of the pandemic in 2020 and 21.
More of that, people dying.
Well, during COVID, I was actually in the ER. It was crazy. It was intense. It was busy. There's a lot of folks dying. And I actually got out. I actually left the ER because it was just too much. You're overworked. You're getting the same pay as folks that's just like chilling, doing their, day-to-day same thing, So it was a lot. There are folks that are still, hurting from dealing with the amount of death on a daily basis. There are folks who just didn't want to stay home because their colleagues were going to work short-staffed, and they just felt bad, so they just went in and they just like pushed themselves to, be a helping hand to their colleagues, but they were still dealing with trauma when they went in.
When they left,
I just pulled myself out of it. I went to the cardiac cath lab where it was a little bit, better. It was easier.
Is there like resources for nurses to deal with the kind of trauma you deal with? Like, is it like?
There are tons, but I feel like it's not enough. There are folks from like, the employee health that would come by with like a dog to play with and things like that. But I mean, hey, like I'm not an animal person. Like,
that puppy.
The dog is cute or whatever, but like, you need like hours with someone to like talk through trauma, and a lot of nurses don't have that. The hospitals give you someone that you can probably call and talk to once a month for maybe like 30 minutes. But it's not enough. They need like a whole team to like reach out to those that are struggling and like talk to them for maybe an hour once every week, maybe even more, because the help isn't there for nurses.
And specifically, why did you decide to leave? Was it because like it was just, you said it was too much, but like, was it the workload? Was it the fact that you were just literally seeing death? Like what exactly was it?
I saw tons of death, and it's just the workload was heavy, but I felt myself getting like tired. Like I'd be tired going into work. I'd be sleepy driving into work. My feet would be killing me because there was never enough staff. Like my left foot was like on fire every day, and I kept on going because if I didn't, I kept on going, for overtime, because if I didn't, my colleagues would have more work. And they would do the same for me, so I would feel bad. But then there became a point where it was just like, it's too much. Someone else needs to come in and do this because I don't feel like I'm strong enough to help them.
Was the Was it short staffed because there was too much work, or was it short staffed because some nurses decided to stop working because of COVID?
Well, in the height of COVID, only a few stopped working. Okay. We did get some help, but the volume was just so much, you know, that you just couldn't deal. You know.
Jasmine, what?
I had a different experience because
were you in urgent care at the time, or?
Yeah.
Okay.
So I'm in the clinic, so it's different, but I was geared up with the gown, like the cap, the blue gown, the boots, the mask, shield,
the hazmat
everything.
suit.
The spacesuit on.
Spacesuit on, exactly. And pretty much, I could see almost 200 patients a day because everybody wanted to do COVID swab, COVID like rapid PCRs, or they're sick. I have to get medication. So imagine my day just. Like, come in, get out. Come in, get out. Come in, get out. And I'm the only provider there.
You're the only provider in this place?
I'm the only provider in the place, so I have to see each and every person. Wow. And I come home tired. Yeah. But the most thing that really, like, during COVID, you see a lot of nurses, or just not nurses, healthcare providers or staff come in with depression. And they're like, I can't see this anymore. I can't do this. I feel like I'm going to commit suicide. And, like, those times, it was hard. Because I'm not a therapist, but I was just trying my best to help these people, like, seek help. Like, I would prefer them to the hospital psychiatrist or the ER if they're really serious. It was bad.
So it sounds like you both, like, and most people, like, they just found strength in knowing that others needed them. Like, your colleagues needed you. So that's why that's soldier mentality.
Internalize all that stress and just keep on moving.
I was rooting, like, even though I'm not in the ER, but, like, I know how they feel. Like, I'm rooting because that could be your family member right there, and you're just like, you can't do anything. Right. People were saying, I can't see my family member because they're not letting me in the hospital. I'm like, I'm sorry, I don't know what to do. Like, you gotta kind of help them like that.
And did you guys get COVID, or? Yeah. You did?
Yeah. Actually, when I worked in the ER, I did not get COVID. I got COVID hanging out with my co-workers a few months ago. It was like, COVID was like dying.
Bullshit, man.
We went to the bar and we had drinks, and like almost everyone got COVID. And like we work in a clean unit, so there's no COVID on our unit now. But I got COVID going to a bar.
Damn, yo. You just went through the whole pandemic helping everybody.
Get you one way or another.
It got me.
I got COVID, and my job kept calling me to go back to work the next 2 days. That's crazy.
Yeah, one of my friends did the same thing because they work in a similar field, and he just got COVID. And, like, 2-3 days later, they're like, hey.
They're like, come back. It's short.
You got that test? Let me see that test. You got that test for me? You got the negatives? Hey, come on back in. Damn, yo. And were you recent too, or like a while ago?
Recent.
Oh, wow. Damn.
Yeah.
Oh, yeah.
Yeah.
No, okay.
So I'm sure that even though it was really hectic, I'm sure that medicine overall has learned some things from this, right? At least we would hope. So do you see any kind of like changes that have been made in your fields where like it's like, they're doing things better? Because like I'm working in a school and I see like I have staff members that will put the mask on because they feel like a little cough. And now we're like adopting this practice that they've been doing in Asian countries where if you're sick, you feel a little sore throat, you put a mask on and it's like just courteous. And I feel like we're adopting that now. So I don't wear a mask at work because I'm not sick, right? And I don't. But if I were to feel sick, I'm gonna put a mask on because I don't want to give it to somebody else. Like it's just on my conscience. You know?
Yeah, that makes sense.
Right.
I'm just saying.
But the thing is before COVID, if I was sick, I'd just be walking around like COVID, wiping my nose, and so. Are there things now that have changed in the like that dynamic of the environment y'all work in, and what they've learned? Because I know, I was hearing during the pandemic that they realized their air circulation in some hospitals was not up to par. That like the bottom floors were like taking all of the air from the top of the building and funneling it through the bottom, and then going out the building. Oh no, or it was the other way around. But where all the sick people were, that air was being sucked in and then through the entire building. And they were like, we need to switch up our air filtration system. Like now every floor has to be getting its own air from a filter. Like it's all, like, you know, they implement. So do you see any implementation like that, or any changes? Well, or they still just, we just running the same. You know? Like,
no, like, well, in my clinic we have COVID rooms now. Just if you think someone has the symptoms, we put them in there, and then we have a sign saying if they're positive COVID, we have to clean the room within like 20 minutes before the next patient come in. And then, like my seat next to the medical assistant, we have to sit 6 feet away from each other. There's no more.
So y'all still do this
indefinitely?
Yeah. Like, Rowen would not be next to me. Okay.
Sorry, we violating y'all.
We don't got a lot of space. When we get the wide angle, the candles, you can stand all the way over there. Right? Yeah, what about you, for you, Rome, in the trenches?
So we pretty much had our same setup. All of our patients who had COVID would end up in a negative pressure room, where the air would just get sucked out. Now, I'm not sure where the air went, but I know that it was very
into the McDonald's next door.
But as far as things being changed, that I do not know. I'm sure that there are other folks in, I guess, upper management that did some sort of change, but I just don't know.
But there's nothing to like the hours of your shifts, or any sort of changes in the way that the staff, you know, move around, or, you know, or the frequency of I don't know, like something along those lines of like.
They didn't hire a bunch of more nurses.
They did hire a ton.
That didn't change on my end.
No.
On my end, a ton. Well, there was a ton that did leave, but there was a ton that was hired.
Well, I mean, were you hearing through the grapevine why they left? It was the stress of the job from that, or?
Well, COVID increased the pay of travel nurses. Travel nurses got paid almost double what like a staff nurse like myself would get paid.
Well, what's the difference between what's a travel nurse like?
A travel nurse is someone that, you know, travels all around the U.S. different cities, different states, and they would supplement the staff in a place that needed staff. So they would do like a contract for like 12, 13 weeks, and, you know, help.
Substitute nursing.
Yeah. Substitute nursing. Yeah, exactly.
Substitute nursing.
Yeah.
Now, they would get paid double, you said?
To get paid a lot more.
Really?
Yeah.
So I never heard of that until COVID. Was that something that was going on before COVID?
Yes.
When you had substitute nursing?
Yeah. There was. But there's that. There weren't a lot of nurses that did it because you didn't know where you would end up. I mean, you had like a city that you wanted to go to.
It's like flight attendant. You know,
yeah, but you didn't really know where you would end
You weren't
up.
picking. You were like, I'm trying.
You have somewhat of a choice.
I want to travel nurse to Hawaii. You know.
I mean, yes, you definitely can.
You have options.
Yeah, you have options, but you can end up in a shitty place or you can end up in a nice place.
But how does it work? Do you
Fucking Idaho.
you sound like a tour contract? Like you have like, are you getting a job with a business that's then gonna lease you out, or do you sign a contract with a hospital specifically, and then you can choose whatever you want?
So you're contracted to a business.
Okay.
So it's the travel agency, right? And they would say, hey, we have, you know,
ABC.
Yeah, we have this place in this city. We have these 5 places in this city, and you can go there, you know, or you can say, I want to go to, I don't know.
Hawaii.
Anyway, right, and they'll place you. Yeah,
okay.
and you
Okay,
get
so you
to
do have
choose.
some say.
Yeah, you do.
We have some.
All right, they don't just send you randomly.
Each
No, you
location is
just don't
different
end up
pay.
in a random place.
Oh,
no.
okay. That makes sense.
So since you were working in a clinic, did you also have to adapt to the telehealth aspect? I'm sure you weren't doing no telehealth, right?
Nope.
Right.
That shit sounds nice, but nope.
Right, because when the telehealth was coming out, I was like,
telehealth gunshot wound.
What are you doing? Bro, just stick your finger in there and pull it out, man. It's like, it's not that deep, bro. If you can talk to me, you're fine. Yo, be like 50 Cent. Yo, just spit it out. Like. So, because like when I saw this telehealth shit, I was like, yo, baby, if you could, like, I would imagine there being nurse practitioners who's only telehealth. And then we can go live in like a fucking island and be on the beach and be like, oh yes, what? Okay, yes, let's take this message. Okay, next. Swipe. I don't gotta be no. It's like next.
That definitely sounds like tuberculosis.
Oh, 20 minutes is over.
No, I love telehealth.
Really?
I do because it's like business on the top, party on the bottom, and then
like moves. Yeah.
But did you feel like your ability to diagnose wasn't hindered by that?
Yes, because you can't see everything. Like a person come in for ear problem, I can't see them in the ears, and it's like they get frustrated with me, and I can't prescribe nothing if I can't see it.
Right.
Technically by law.
Yeah,
like,
yeah.
So it was kind of hard, and then you have the older patients who didn't know how to use a computer or use the phone. Or, video chat with me.
You're
so that
on
was
mute.
hard. Right. And then, like...
What?
There was always barriers. Like, if I didn't speak Spanish, I don't have it interpreted. Like, I usually have in the clinic someone to speak Spanish for me. So that was kind of hard.
You know what, man? I just thought about that. That telehealth, if it had subtitles with the bouncing ball, like you should Google Translate on the video right on the bottom.
It's coming.
Como está?
It's coming.
It's coming. I just said it out loud, so whoever, I better get a check. I want my 15%.
They're gonna NFT that shit.
NFT that shit.
We're not putting that one in.
We blurred that out. We'll be like, yo, you know what'd be a really good idea?
Nah, that's a great idea, actually.
But you could work on your own time, wherever. Like, I used to live in Connecticut. I used to work in the backyard. So it was good.
Life is good.
Life was
And
good.
is that can you get that job? Like, are they hiring for just that position, or is that something more
So,
that?
like, I have a second job that I just do COVID results, and that's it. So I can just talk to anywhere, anytime, make my own schedule. That's my job. That's it.
Okay, so I kind of wanted to ask, because you're doing the COVID results, right? What do you mean by that? So, like, you're getting the tests and you're analyzing, and then being able to say, oh, you have COVID. Is the top positive test?
You
or
just
a
read them
negative
the
test?
answer.
Yeah, then they said you give them a call. Yo, you got it.
Just
Yo, you just got that shit, boy.
You got the bid.
You got that clap.
We ordered a syrup roll.
Well, whatever company that you work for, they have a lab. So they send a result and it says either negative or positive. So you're literally just reading it. And then, you're literally just reading it. And then the patient's going to ask you questions like,
Tons
what
of
do you,
questions.
how, do I quarantine? Can I get a doctor's note? Can I get some cough medicine? What can I do? Blah, blah, blah. So that's what I'm doing.
Because I wanted to ask, because there was a lot of like talk about like false positives and false negatives, but I'm sure like you didn't like that. I would have to ask somebody in the lab to like kind of explain how could you falsely test positive for something that you don't have.
That's a great question.
in your body. Right, if it's not there, how can a false positive ever come to fruition? You know,
It could be not enough sample on the swab.
but if it's not enough,
It should come
but
out
so
like-
if it's
it
not
should
enough
say
sample
no.
on the swab, the test is gonna be like, you got it. I'm gonna say yeah. It's not no focus on that shit, so you got it. Yo, what?
Well,
Like the
that's
opposite of reasonable.
Exactly.
being on that side,
You're
of the
guilty.
end, being on that end of the, like, when I get those results, I'm like, well, there's not enough samples, so you gotta retest.
Oh,
Like,
okay.
yeah.
So,
Oh, so maybe they say you're positive just to emphasize that you got to test again. Yeah, but that will fuck somebody up, man. You know what I'm saying? They say you got to.
might got it.
You might have got it. You got half of it. You got the cold. I don't know if you got the vid, but you got COVID. You got COVID 9.5. Yeah, man.
He's like that, bro.
Yeah, but I mean, but like, Rowan, you obviously could not have done your job like remotely. Like,
No.
I mean, no. Like, I mean, and
In
it was
ER?
like,
Hell no.
it was interesting because there was I was seeing like a lot of like discussions about. Well, this is for the super wealthy rich, but like having like this futuristic existence of having this device that can like look in your ear and like, you know, hook it up to your computer, and they'd be like, oh, just put it in your ear, put it in your nose. You know what I'm saying? Blood sample, put it here, and the data, this little box will be able to like send the information to you, and you can diagnose. Whereas like physically,
wasn't that was a scam, right?
a scam.
Wasn't that like that Hollywood or some shit? Some lady made a machine like that, and it was just a scam.
Well, no, I know there's people who are developing something like that. Like it's like a little box, and you could like prick your finger and get a little blood sample or something, and they could like it can read. Do all the like checkup
the
stuff.
shit for like insulin, like right?
Insulin is like there's a little device but what I'm saying is like it's like this little box that has all these things that you can just do the checkup, like a regular checkup, and you as a service provider could be like, okay, I see that there's data. All right, you're need to worry about this, you need to worry about that, or this is fine. So for you, it's like you would need a whole robot to like come and like pull the dildo out of their ass that's like in their intestines or some shit.
I've actually seen that before.
I'm sure. Yo, you know what?
I've seen that
a glass
dildo.
Is that a common?
No, it's a common thing for people to
yo, folks.
stick things up their ass
anything.
like crazy.
Light bulbs, anything.
Glass
a cigar can.
I seen a cigarette in somebody's vagina.
A cigarette in someone's vagina?
And when I worked in ER, yeah.
Smoked cigarette?
Was it like half done?
It was half done. Yeah.
Yo, listen.
Like she was trying to save
She was
it.
saving it for later. You know, listen. Make it a little zesty.
Did she suspect that it was a cigarette in her vagina?
She was very out of it. Like she was like a drug user. So I don't know what was in her mind. Yeah.
What's up?
Probably blowing smoke.
Yo, like the magic trick. She like.
What made you?
I figured we were gonna stay here for a while.
What made y'all go looking for anything in her vagina? Did she have like a pain in her vagina?
It would be her that would be going in. I don't go in. Oh my god.
So Foley's. There we go. Back to Foley's.
Oh,
You have to go in the vagina to get a Foley. So she had a cigarette in there.
That's crazy, man.
She was unconscious, so we had to put a Foley in her, and then we found that in there.
The Foley was what was the Foley for?
Yo,
so she could get.
You want to hit this?
So you went into this lady's vagina for completely unrelated cigarette reason, and you just came back with shit. Like,
wait, folks, what's that? Oh, cigarette.
Yeah, like, okay.
She got ashes all in. Anybody like a hose her down? Wait, hold it open.
She was unconscious though when she came.
You had to induce her.
Yeah.
So I'm just trying to figure out how she's unconscious. How y'all got down there?
Yeah, so there's a ton of reason. So you'd pretty much put a tube in their throat to help them breathe. Mm-hmm. If like someone can't protect their own airway, you would intubate them, or the doctor would, or the NP or the PA would. They put that tube in to help them breathe, and since they're unconscious, you pretty much have to like collect urine, make sure they're not covered in urine. So you put a Foley in, and I guess when you put in your Foley, you pretty much, as you go in, you see crazy things, and she just happened to see a cigarette.
Half-finished cigarette.
All right. So it might not have been any way related to her unconsciousness, basically.
No.
So,
they didn't put it in there to pull it out. Like
cigarette was laced.
Yeah.
No, I'm just, it just.
You would think you would be related to her.
That's what I'm trying to say.
How do you have two separate problems? You're unconscious and you happen to have a cigarette in your vagina.
That's what I'm saying. Like, the way it was presented to me was that this unconscious lady came in, and it turned out she had a cigarette in her vagina.
Listen, man, it probably fell and she sat on it or something. Like,
she sucked it up.
Did she get informed about the cigarette at one point in the process?
At that point, I don't know.
She may or may not know.
She may not know.
We also may not know.
She could be like fully recovered, have two kids.
They would not know.
Like two twins.
like, last week I came in here and I had a cigarette. Y'all still got my cigarette? Because I've been looking for that shit. It's not where I put it. I don't know if y'all steal shit in here, but I'm gonna get my cigarette back.
This is unprofessional. Unprofessional.
Yeah, Caesar's expensive. You worry about gas?
It's COVID. We smoked it. We stressed. We smoke anything.
Listen, we don't waste nothing in my family. Damn, man, that's crazy.
Yo, so back to the professional part, I guess. So do y'all do your own billing? Like, how does that work?
I don't.
I do. Yeah, I do.
And
So
how's that?
depending on how severe the patient is and how many procedures I do for a patient. For example, if I do stitches, so you have to pay for the lidocaine. You have to bill for the procedure I'm doing, the time that I'm there, because it takes me 30 minutes. So you stack up.
Yep.
How much is one stitch?
Ooh.
Honey.
Like for one visit, we just do it a package. It's like 200.
Okay.
That's not bad.
That's
$200
without
a
insurance.
visit. That's
Now,
without insurance. Yeah.
so perfect. So the question is now, how do you bill it with insurance companies, right? Because like like medical insurance just is nuts. Like the hustle to get the money you're worth of your services is nuts to me. So talk about like how that impacts your billing, like dealing with medical insurance companies.
Well, a lot of times, if you don't put the right information, the insurance is not going to pay. So if I don't say that I saw, how you would say, if I don't document that I didn't see the person's eyes, and the person who came in for eye infection, then they're not going to pay for it. Pretty much, yeah. So you have to be very detailed on everything that you do. And then if they send the check back or they send the bill back, you have to go in and change everything, unlock your notes. You have to like send it back. So you got to keep sending it back. If they don't like it, they'll send it back to you. Then you send it back to them. So it's like a going back and forth game.
And the notes get locked.
Coding,
Yeah.
everything.
Coding, yeah.
I wonder if the cigarette was covered on these.
It might have been.
Like, no, we
Foreign
don't
bodies,
cover
it's a
that.
Foreign bodies.
Nah,
Yeah,
like,
man.
but like you know, but then like so I hear a lot of times where like you would bill for like say you really did like $20,000 worth of work, you might get $300.
Yes. So every insurance pays for certain things differently. So Medicaid pays less. So Medicaid will pay
Sounds about right.
$30 for something that costs $1 million.
Yeah.
You could do all that work. So that's why I have to limit myself when I see patients. Patients come in for 10 different things. I said, no, I'm only going to see you for 2. Because if you do all 10, they're not paying for that. So I have to limit myself.
10 things would take a lot of time.
Yeah.
Yeah, so.
So yeah.
And does that come out of the company's pocket? Like they, if you were to do those 10 things, it's kind of goes against.
It's a huge loss. It's a huge loss.
Profit loss.
Yeah. So you can't just think. I mean, you think about the patient. You would do as much as you can for the patient.
Yeah, that was gonna be my
But
next
at the
question.
same time, you can't spend 6
company,
hours with
yeah.
one person, and you're only gonna get paid $200 for it.
Right.
Meanwhile, you've got a whole
Line of people. that you're gonna get
patients
through.
waiting, and you don't even know what they're there for yet.
Right.
You know
That could really be very time consuming.
exactly.
And if the insurance company doesn't pay for it, there's no way for you to recoup that difference. Like that,
No.
like by them having insurance, you just
Whatever they give you, that's what you have.
Yeah, the
You're not getting no money.
insurance companies will have their like
agreement.
their agreement how much they would give, according to what you code and your notes. So let's say you would send the insurance company your bill for like $1,000. Their agreement would be 200, and you just have to take that and you eat the loss on the 8.
Better than zero.
Yeah, it's better than 0, exactly.
But like in the ER, y'all just be running it up though. Like,
See, I don't deal with billing in the
You know
ER.
what I'm saying? Like, y'all be like, click, 300 down, baby, for stuck toe. 2 cigarettes. Fuck out of here. Y'all be running that shit up, bro. Motherfuckers is taking Ubers to the hospital, bro.
I've
That's the difference.
glimpsed at like ER bills,
Yeah.
because I don't deal with it. I don't want to look at it because it's just something that I don't need to really know. But I've glimpsed at some, and some folks come in for like an earache, and it's like $1,600. And I'm like, oh my gosh.
Like, they be racking it
Folks
up.
are like, all right, I just got to use my credit card. Yeah.
Suck a dick. Bill me.
But it's, hey, it is.
That's why they send
it
it
is
to
right
me.
now.
Because we charge less than the ER. Way
I have a
less.
question. So you guys said you were stationed in a urgent care, correct?
She's in an urgent care. I used to be in the ER, but now I'm in the
All right, so
cath
you have
lab.
been in the ER. So what would you say will be the difference between an urgent care and the ER? Because it's kind of the same thing. I think urgent care I think ER is more 24 hours. And urgent care is like, all right, we out of 10 o'clock.
We close. You gotta come back tomorrow.
9 to 5. Yeah.
Outside of that, well, as far as the service in regards of what I need, if I needed to go somewhere at 6 o'clock, like should I go to urgent care or should I go to ER? Like, which
What I mean,
one
it
will
really,
provide better service.
I mean, it really comes down to what you're going for.
Right.
Now, if you're going for like, a sore throat, your knee hurts, you need a medication refill, I would say go to the urgent care. She would take care of you. She will, make sure everything is right. But if your ankle is facing that way, and you need an X-ray, you might need
you got a cigarette in your vagina.
stay in the hospital. Exactly. Go to the ER.
Cigarette in their vagina tap.
Yo, bro, listen. I'm making a T-shirt with a vagina with a cigarette in it like this.
Let's say you're trying to pee, but you can't pee, but you just have to go so bad, and you need a Foley. Go to the ER because the urgent care likely won't have Foley,
They'll have to send you
and
to
it
the
won't likely have a scanner.
Yo, you ain't got them in
A
the back.
CAT scan. So you need to go to a place with the resources to help you. But then at the same time, you have to educate yourself on what you need. There are tons of folks that don't do their due diligence and educate themselves on what they need to get done. So they just end up going to the urgent care and expecting, hey, I would need blood work, I need fluids,
That's
I
the
need a
mentality.
scan.
Yeah, it's like, hey, I'm broken. Fix me.
Yeah, right.
Like,
This is know the places where you need to go to get help.
yeah, you don't go to a car wash if your oil needs changing. Like,
Exactly.
That's not the spot, bro. If you got
If
both your ankles broke off.
I went to MD one time, and WebMD, and I thought I was dying.
Nah, don't never go to WebMD, bro. Don't ever go to WebMD, man.
That's
Listen,
right, hey.
anytime you look up something on WebMD, it's always cancer, bro. Always.
Something deadly.
That's a setup.
The worst thing is you're gonna die.
Yep.
No, I had a lot of patients come to me in the urgent care. Like, for example, one patient woke up this morning with a headache and his face is lopsided.
Lopsided.
Yeah, stroke.
Like one is just like droopy.
He had a stroke. And he's like, I don't want to go to ER because I want to get COVID. I'm like, what do you mean you're going to get COVID? You're going to die. Like, come on. So those situations, the patient need to be educated. Like, you're going to die if you don't go to ER. We don't have those resources.
And
Like,
he went to urgent care.
he went to urgent care.
Drove all the way over.
Waited. He had to put it he had to put an idea in that machine.
Hey. That's why you
Yeah, and
need
he couldn't
to,
speak right, so you know he had a
How did he not know he
How
had
did the
a stroke?
receptionist not be like,
No, so
hey.
that's the thing. I train my staff to know what to look for. Don't have them waiting.
Like,
Call
oh
me.
no, honey, no.
Yeah. That
I'm not even
is.
putting you on a list. First of
Exactly.
there's 20 people in front of you and you ain't gonna make it. I got a bench with a cigarette out vagina. You don't have to wait out.
No, but that's actually good information. Like, so what are some of the signs you would say to look for because like I feel like people always tell people about that to look for certain signs of strokes. It's not as obvious as you may think. So what are some of the signs you may think that people should look for?
well,
Face is definitely one.
The obvious face.
Would you also ask them to like raise both of their
yeah,
hands?
we're,
And if it's
one
like
is
this,
falling, but then so the very first thing that folks need to do, let's say you are a drug user or you have high blood pressure, whatever it is that you have, whatever it is that causes you to be predisposed to like a stroke or whatever. You need to take care of yourself by educating yourself on those signs. Whatever the signs are for whatever condition you may end up getting, you need to educate yourself. And a lot of folks don't, but you need to.
Oh man.
You gonna jump off a plane, wear a parachute.
Right. Hell yeah.
Hey,
All right.
Hell yeah.
Right.
Damn, I had a question, but keep thinking about this chick with a
stuck in my mind too. I'm like,
Yo, she gonna live forever in my life.
She have a lighter in her pocket.
She had a lighter in her butt.
I mean, I guess we have like 50.
Yeah, we have 50, baby.
Yeah, all right. So, well, listen, thank y'all for coming through.
thank you, I appreciate it.
Yeah, it was a very interesting conversation.
Doing the
There
education.
could be a lot more. I'm telling
Yeah.
you. Body parts and everything.
Yeah.
I mean, we should get a half
Listen,
episode of fucked up stories from the ER.
Yeah, we could do that.
We could do that.
There's a reason. There's a reason I did law school and not med school. and it's not so much blood. It's actually vomit. I just can't stand vomit.
Really?
Yeah.
Now, you know,
Bro,
like,
the ER, the urgent care is all vomit.
Yeah.
Like
I'm
half of your patients like, ugh, the whole time.
Now, to me, like I was saying, like when it came to Valeria's thing, it wasn't like the blood. I was like all right with that, used to that, but it was like the bodies that were like open, and then she was like, "Look, it's this tool that they put in the ribs, and they go."
But that's the best
Nah,
part.
man, that's too.
That's the best part.
You know,
I don't want to see that shit.
one of the scariest
I'm from
things
the
I've
hood.
ever
I'm from the
seen.
horror film, bro. Like,
It was my first job, and it was my first night shift, and it was early morning. It was like 5:36. It was this guy going to work, and they brought him in with like his like he's like sitting in the stretcher, and he's like barely alive, right? And he was going into work, and they had his lunch, his like bag of lunch on the stretcher with him, and there was another bag with his legs, and I was like, oh my gosh, he got hit by a train.
So somebody said,
And
He got hit
yes, he got hit by a train, and his lower half was in a large red bag, and they brought him into our resource room. It was crazy.
listen.
I was like, what the?
Listen, you know
what
why?
did I
You
get
know why?
myself
Because
into?
if you bring half of them to the hospital, you only could charge him half the bill. If you got his whole body, you gotta pay the whole
Hey.
check. Run it up, clank.
Why the lunch, though? Why did they grab the lunch?
I mean, you
Just in case
grab
you're not
everything. Hey, I mean, it was his. You grab everything. And I was like,
Nah, you
what the
can't
hell
leave
is
that
going
shit
on?
behind. This is
I did
yours.
not expect that. It was crazy.
Well, you gonna be appreciative when he wakes up like, I need to grab my lunch.
I mean, unfortunately, he did not make it.
He had a chopped cheese.
Yo, we're evil. What the hell?
Hey, ain't no weak. Nah, bro. I'm good.
We gotta end it on that, bro.
It's too late for this shit.
Thank you. Come again. It's the last episode. Bro.
We getting canceled after this shit.
Oh, man.
Oh my god, yo.
But like another thing is like we're good at it. We're good at looking at or making fun of bad things. A lot of folks can't.
Yeah.
And I think a lot of folks need to
I mean,
make light
yeah.
of all the bad things so that you can move forward
Yes.
with
I
your
think that's-
life.
That's absolutely necessary in any
So
profession.
it is necessary.
Although
A lot of folks can't. It's necessary.
Yeah, you see trauma all the time.
Gotta process it.
You have to process
You
it
have
in
to
a
process
healthy
it
way.
Better laugh
in
than
healthy
they cry.
ways. You
Yeah,
have to
man.
laugh about things. You know, if a friend dies, you got to be like, my friend lived a good life. Not they could have done more. You could just say, hey, my friend lived a good life. They had fun. You know, I had fun with them. That's a good way to process death and dying. Yeah.
We laugh about how our clients get caught all the time.
Yeah, and you need to, because you can't be like, "Oh, I'm so sorry," every time, because now you're gonna end up having a stroke.
Yes, exactly.
Stressing over that
Exactly. You have to,
process it
Oh,
in
yeah.
a healthy way. Yeah.
My whole thing is that this shit ain't happening to me.
He say that shit all the time.
Tell
bro.
my colleagues, just like, yo, my man's like, I think your job is your job, but you take it on too personally, my dude. Like, you ain't going to jail. Relax, bruh.
Yeah, with me, there's a lot of like really sad stories when it comes to like the students that I work with, and like the situations they come from. But then like there's a day where they'll just act like a dickhead. They act like an asshole. And then I'm like, you know what, man? I know your life is tough, but fuck these kids, man. You know, not really, but it's like, yo, nah, I just like you to let me say it. You know, because y'all an asshole. You're so mean to me.
Top cheese.
Oh God, yo.
All right.
I mean, equal opportunity, Jasmine. You got any terrible stories you want to share, or that's you ain't no pressure.
There are many.
Ain't no pressure.
Find one.
Ain't no pressure. I'm just saying, you know.
I'm trying to think. I'm like, which one?
Woman with the cigarette. That could be top.
Nah, that's top. I like that one for now. We can come back and we can get it
on top. Nah, yo. All right.
I get a lot of bronchusha in my clinic, so.
Oh, okay.
We get
What's
Bonquishas?
Bonquishas.
What the hell is that?
A patient who comes in with eyelashes I have a patient who comes in with her eyelashes are pink and look like a bat laugh.
Yeah. Oh, they're super long, like they're really exaggerated.
Oh, okay.
And they wonder why they have eye infections. A lot of those. So,
You know, hey, listen. Sometimes stupidity pays the bills. You know?
That's right. Hey, we are employed. We're all employed.
Exactly. Stupidity pays the bills, baby.
When society becomes perfect, we will be unemployed.
Exactly.
I don't want to live in utopia.
I know, because I'm like, I don't know what to do anymore.
Yeah, fuck that. All right. Yeah, this was dope. This is dope. It was actually I should do the laugh a little bit because this shit was hilarious.
It was fun.
So sponsors.
Sponsors? You do sponsors?
I don't know. You got the pad.
So the artist of the week.
Yes.
The artist of the week is Stephen Rabufio. Stephen Rabufio is a digital designer. He's a digital art. He's a digital artist, and so what he does is he uses a lot of photography and the Illustrator application, and he makes all of these very abstract but beautiful images, all digital images. You could definitely check out his work more in our blog, on this week's blog, and check his stuff out because he's dope. I've seen him in art galleries alongside of a few other artists of the week that we've had, and I really like his stuff. So definitely check it out.
Dope.
Awesome. And our sponsor this week is Vegan Botanica.
Yes.
Vegan Botanica, it's a multi-use space in which you can go and get advice about healthy living, how to treat your body right, how to eat right. They also have a program in which you can help support their cause, and they will give you some marijuana in return. As a gift. They are located in Riverdale. You can get more information about their location at vbgotme.com. It's an awesome space. It's a good place just to go and hang out and learn about how to eat right and how to feel right.
And to stay healthy, be healthy.
Stay healthy.
In other words, they're in direct competition with y'all.
No, but that's like our goal. That's our goal.
Yeah.
Is folks need to be healthy so they don't end up with us.
Cheese.
Right. I mean, there are things that do happen, but like there are things that you can avoid, like a stroke, a heart attack, things like that. Yeah. So that's a great sponsor.
Right.
And I think folks should listen.
You paid to make sure all this is still rocking.
Thank you.
No, it wasn't. That was like last week or so. It was a couple weeks ago.
Space time continues.
Kept the bills on for us to
Pull the
be
curtain
here,
back.
so it does count.
All right. Got any social media you want people to know about or not, or you want to stay?
Yeah,
hidden
of course.
Okay.
So it's all hers. So she's got she's Jazzy the NP on IG, so you can check out her page, and you can also, if you're looking to get a marijuana card, quick 420 cards on IG.
All right. Okay.
So.
Thank you. Yeah.
Hey.
That's what you get for touching the goddamn board.
That one.
All right. Anything else, or that's it? Websites or anything? You good?
That's it.
That's it for now.
Yo, thank you, man. This was beautiful.
Appreciate the love.
And we out. Jerry's out, baby.
So how was that? Not bad.
So what they're saying, right? Just be clear for our audience, because I actually read that article. I didn't look at the headline.
But let's
what they said was
dropping gems like we preaching. Don't overstep the line of my freedom of speaking. We cast to the world, put the words in the street and connecting all the minds of the people we reaching.
Yo, tempted to get fenced in and contempting. Teach you motherfuckers a lesson and pressing the issue at hand. Nah, I don't care about objections, suspensions, and cell inspections. Just suppression of black lives is my passion. And love for my fam is everlasting. So stop gassing these asses with glasses. Cause in the end, I leave them where the trash is.
Jury's out. Jury's out. There's no doubt we be about, and we kick it to the masses. Trying to spit the law, and they laugh off our asses. Breaking down the latest shit, carrying crazy lady shit. Glad I ain't got no baby shit. COVID got me crazy, bitch. Damn, and you gon' have to edit this. The jury's out, so you can't even credit us. No statements null and void, invalid evidence. No, you can't take us to court, cause you know. Jury's out. Jury's out. Jury's out. Jury's out.
I like to share knowledge. I like to share knowledge.
Again, it's more than sharing knowledge. It's
what is it?
Ask any attorney. When the jury's out, there's not a care in the world be. You sit and talk shit no matter where the judge be. Cause she can't judge me. My job is done because my God not guilty. Don't try to tempt me to hell, I will send me. Look behind me, the team is with me. The jury's out, yeah, the jury's out. And if you got a doubt, is walking out.
yup.
I'm not force feeding anyone knowledge. Do you see? I don't see a gun.
You don't need a gun to force anything, right? You know?
Dude, you can force people. You can force people to feed them knowledge by making them feel stupid. You can just be like, we know you don't understand. I'm gonna break it down, and then they're like, oh, okay. Am I wrong with people's will? Yes. So does water kills rocks. You know what I mean? Like that's just a side effect. So does religion. I think religion, no. No. I think I'm better than a fucking like religion. I feel like it's on its last breath. Like I think I don't wanna. I think I'm smoother than that.
It's definitely not on his last breath.